Dyslexia is a type of learning disability, which is the most important one, and definitely you have heard it. The history of dyslexia goes back to 18th century. From that time, scientists and professors, they were trying to find the solution and treatment for dyslexia. Cause of dyslexia, according to last researchers, are genetic and hereditary, which the first one and the most important one is. This means dyslexia goes through families. The second one is brain-based problem in decoding our written language. And the other one is environmental factors during and after pregnancy. Dyslexia has another causes such as brain function. Excellent readers usually use 3 parts of their brain, but dyslexic person use just 1 part. Another factor which is so important in occurring dyslexia is early language development issues. And some professors believe early ear infection can be the cause of dyslexia as well. So, I have to say to you that dyslexia totally is not connected to intelligence. This means there is no connection between intelligence and dyslexia. So all the dyslexic person, they have at least normal level of intelligence. There are 5 types of dyslexia available, although there are variety of classification, but the most one is these 5: phonological, developmental, acquired, surface, and deep dyslexia. These 5 types of dyslexia are the most common types through dyslexic people. Most of the students or most of the people who are facing with dyslexia, they are in type 1. This means developmental, which is phonological category also. So, you know, the most important things and the most factor to helping children or people with dyslexia is that we should know dyslexia is treatable. But so many of people, they think that is dyslexia curable or no? The answer is no. Dyslexia is not curable. Why? Because it's not a disease. Dyslexia is neurological based problem, which is not a disease. So, cause it's not a disease, there is no cure for it. But it's treatable and you can overcome dyslexia. There are so many other issues which can occur with dyslexia, such as hyperactivity, ADHD, ADD, or so many other things. But you should know that dyslexic person can have other issue combined with dyslexia, but it's not connected to dyslexia. This means that if a child or a person has hyperactivity, it doesn't mean that for solving dyslexia, we should solve hyperactivity. If you solve hyperactivity over there, of course you get better situation, you have better solution, and you can improve in terms of reading as well. But dyslexia doesn't finish. Why? Because dyslexia is another issue which sometimes get combined by other problem as well. For helping to people who are dyslexic, at first we should have a right diagnosis. But how can we have a right diagnosis? The best thing, the best method for having the good diagnosis is to have a battery test. Why do we call it battery test? Because there is no individual test for diagnosing dyslexia. Dyslexia cause it's one type of learning disability, and as I told you, it's sometimes combined with other things. That's why it's impossible to get, you know, the right diagnosis by just one test. So we need variety of tests which can understand and identify hyperactivity, attention, focus, learning disability in terms of, dyslexia, dyscalculia, dysgraphia, and other types, and also intelligence level of the child. After getting these category of tests, then we have the right and proper diagnosis. This means we know as an expert that the person has dyslexia in which area, which type, and with what severity. After that, we are able to help it. But for solving or overcoming dyslexia, we should know that what is etiology of dyslexia. There are variety of theories available to solving dyslexia, but all of these theories are based on 4 factors and based on 4 special categories. As I told you, for helping a dyslexic person, we should know etiology of disability. Generally, in all existing theories and in all categories, etiology of reading disabilities is based on 4 principles. First, impaired visual perception and visual memory. Second, impaired combined sensory. Third, impaired reminding of the sequences and series. And the last one is impaired verbal processing. This means that if we are gonna help a person who has dyslexia, we should solve these 4 categories. But how? How we are able to solve dyslexia by helping these 4 categories? So, the most important thing before starting helping the people with dyslexia is that we should believe and we should know that dyslexia is treatable. Unfortunately, even with so many and mass of researchers, still there are so many parents, teachers, and unfortunately psychologists who they believe dyslexia can't be treatable. But it's not right. According to the last researchers, we are able to manage dyslexia and we can overcome this issue by right and proper treatment methods. So, but what is those treatment methods? I'm going to tell you what are the proper treatment methods for solving dyslexia. Again, I'm telling you, before starting the treatment, first we should get proper dyslexia diagnosis or proper dyslexia test, which in common they say learning disability test. Okay, let's go to treatment. Now I'm going to tell you what steps, what issues, and what area we should work if we want to get advantage and we want to help a dyslexic person. The first step for treating and helping dyslexic person is exercises for stimulating neurons, axon, and changing dendrites. It is, the most important steps, which can just be happen through neuropsychology. Then we should work on speech-language-based problems. After that, we should go to the other step, which is working on memory issues. Another part, after finishing the memory issues, we should go through exercises for improving pronunciation of letter, phonological issues, auditory memory, auditory sequencing, and audio sensitivity. After that, we should try to empower auditory memory and auditory sequencing. Problems related to visual perceptions and distinguish visual memory and sequencing should be covered as well. Speed and voice of the person also should be controlled. And then we should work on reading experience. Reading experience is the last part of working with dyslexic people, because dyslexic people, they were always have been facing with difficulty in reading. Usually they don't have enough reading experience. If a person or a child get through this level, this means if he can pass all the previous treatment levels and go to this area, this means we have helped the person to overcome the dyslexia. Okay, so as a sum up, I know that I have transferred so many information to you and maybe you be confused, but I'm gonna tell everything as a title and head titled again, that you can get the most important point, and you can get the essence of the talk for a few minutes. As a sum up, we understood that first, dyslexia is phonological and brain developmental based problem. Second, we understood that dyslexia is not a disease, so it's treatable. Third, we know that we can overcome dyslexia. Four, for helping dyslexic person, we should get a right diagnosis and a right and proper learning disability test. Five, helping the people with dyslexia is possible and can happen through the right treatment plan. Six, which is so important, dyslexic person doesn't have intelligence problem. It's possible that a person who has problem in intelligence or intellectually has some issues is not able to read, but we don't call that person dyslexic. And seven, dyslexic and dyslexia can happen with different issues such as hyperactivity. But at the end, if you have a person in your family, or if you have a child or any friend or anybody who you know with dyslexia, remember that it's gonna be a long life-term issue if the person doesn't get help and don't go through therapy. But with right therapy and right treatment, dyslexia can be easily overcome.